We're here with Jeff Grandia, co-founder of Redi Health. Jeff, thanks for joining us today.
Thank you. Appreciate being here.
Awesome. So, Jeff, tell us a little bit about Redi Health, your mission, what you guys are looking to do within the market. We'd love to just get a little quick intro on Redi.
So we've been in the healthcare analytics business for a long time, and we've kind of seen all there is from the top 100 health systems to small community facilities to critical access organizations to clinics. Our focus really early on was the top 100 health systems, and we started helping them with clinical quality improvement, helping use data to improve the performance of their organizations. And my business partner put his arm around me and said, there's another market that really needs to be served, and we need to be focused on kind of the rural and underserved communities and building a business that's focused on helping those communities become actionable with their data and help improve their performance. And when you look at how expensive analytics is in healthcare, most of these communities cannot afford that expense. So what we've done, our mission is actually twofold. One, to help rural and underserved communities make their data actionable, and two, create high-tech jobs in rural communities. Instead of hiring people out of the Bay Area, hiring people out of Dallas and Chicago and Boston, we're hiring in Jackson, Tennessee, and rural Utah, rural Wyoming, rural Georgia. And in that process, we can pay those resources substantially less and give them an opportunity in the high-tech industry to grow their careers, and analytics is that space. When we look at the problem we're trying to solve, that's what gets interesting. When you look at these underserved communities, they do not trust their data. That's fundamentally the challenge in healthcare. And we like to use the analogy of driving a car. When every organization, when you drive your own car, you look at the gas gauge and you trust that gas gauge. These rural communities, when they look at their gas gauge, they look at the performance of their organization, there are 17 gas gauges in that organization. And they all say something different. So which one do you trust? So from our perspective, the first step needs to be integrating this disparate data sources, building a single source of truth. Once that's built, then building a definition of that one gas gauge. And invariably, nobody trusts that process. But once we build that data at a very granular level, and you can help prove to the clinicians, to the administrators, to the patients, what that data is telling them, that's where transformation gets started. And we get excited, and that's the foundation of our business.
Fantastic. And on your website, you've got a quote or a tagline, right? Leveraging community data to improve community care, right? I think that's fantastic. First of all, it's like it really kind of tells in a short phrase, kind of a lot of the focus of some of the partnership we've been working on, and then also just the offering. So, tell us a little bit about how the organizations are leveraging that data, how it translates to improving community care.
So these communities have a tremendous amount of data. They just don't realize they do. And they don't have the expertise and resources to leverage that data. So bringing out those experts, bringing out those resources, and helping them first see the availability of their data. We start small. We start with problems that they're concerned about with their data. Pretty much every one of these communities, the biggest challenge originally is finance. So we're not a rev cycle company, but we help them solve issues around accounts receivable, around denials, and allow them to see that their data can solve these issues. Once that's solved, and once you deal with the most critical challenges, and they get trust in that data, then it becomes to the next step. Let's start talking about how we can improve the performance of the organization clinically, operationally, and continue to improve financially.
Fantastic. We just, you guys at Redi Health did a press release a couple weeks ago related to the work that the collaboration we have going on at Uinta Basin Health. What's most exciting for you about that, the work that you're doing there, and some of the results that you're seeing?
So Uinta Basin is in Roosevelt, Utah, a rural, underserved community with very diverse needs. And the state of Utah has given many grants over the years to most health systems, and most health systems receive grants and funding from the state. And there just isn't a trust between the organizations. They think their incentives are off and their desires are off. Well, the state of Utah gave some flexibility with this funding and allowed Uinta Basin to kind of solve the challenges that were immediate to them. And as mentioned, around denials, we worked on a denials project with Uinta Basin and found a tremendous amount of opportunity and helped them build confidence in their data. Once that happened, Uinta Basin's entire organization got excited and wanted to go to the next step, which the next step is building an analytics platform. And WellStack is a great partner in that process. Once that partnership evolved, then it's now building outside expertise of analytics of what's the power of their data. And they're invested into clinical quality improvement. They're invested into continuing that financial improvement. And they're continued really into engaging their organization into using data to build best practices.
That's fantastic. The other things that we've been talking about, I think, in just some of the discussions we've had over the last few weeks, and as we're seeing certain trends, the topic of transitioning to value-based care and some of the ACO and ACO REACH models, how do you see that kind of emerging or evolving within the underserved community and rural healthcare health systems that you've been interfacing with?
So analytics is the key to success in a population health strategy. And when you have communities that don't trust their data, and you have the pressures of the federal government and local governments to change their models, all of these organizations are nervous about that. What's been fun is you're seeing these ACOs solving the challenges of their clinics, of their hospitals, of their communities, and addressing those challenges immediately and building that trust to actually get into the population health space. Rural and underserved communities are pretty nervous about changing their financial models. And we're excited about the value proposition of WellStack and the years of history we've had supporting population health in the top 100 health systems to come forward and bring that intelligence and insight into these rural and underserved communities.
Yeah, and the team at Redi Health, from our team's perspective, you all have been such amazing partners. The breadth and the depth of the experience that you're bringing in from the services and program management and kind of the way we see clients interacting with you guys has been really great, has been unbelievable. How has it been working with WellStack from your perspective?
WellStack's a phenomenal organization. We're great for the flexibility. The interesting thing about healthcare data that's so unique is there's not one problem to solve. Once you've solved the first problem, there's 1,000 more problems or challenges to address that data can address. And WellStack's flexible architecture, WellStack's engagement into a flexible data model allows our team of experts to leverage that model and to leverage the technology to start not just answering one challenge, but addressing the organization-wide and in dealing with those enterprise issues, whether it be clinically, financially, or operationally. If we're honest about healthcare and we're honest about analytics and the investment in analytics, we can go back over the last 10 years and realize that healthcare has spent billions of dollars in trying to leverage their data. And guess what? Very few organizations have seen an ROI in that. Why is that the case? One, because we keep trying to tell the industry what it should worry about. We keep trying to tell the healthcare industry, here's the problems you need to solve. The reality is we should be using data as data experts to solve the problems that they have with it. Mm-hmm. And most organizations don't want to build that flexible of a solution. So we're trying to convince them we can solve these problems. You don't need to worry about those others. What's the number one issue in healthcare today? The number one issue in healthcare is finance and financial sustainability. Arguably, staffing is equally as big an issue. Staffing can be addressed if your finances are in good shape. So, if you think about that being the first problem we should solve, how many analytics companies, how many data experts are solving and addressing financial issues within healthcare? We're not a rev cycle expert. WellStack's not a rev cycle expert. The reality is we need to go solve that problem first, because once we do, we develop trust, we develop relationships, and we let organizations realize the importance and the value of their data. So going forward, we start out usually with a financial opportunity. Every organization that you can find $500,000, $1 million, $5 million in financial opportunities, then they see the power of their data. And that is happening over and over and over again. And if you focus your organization to address the problem they're concerned about, like finance, you can get ROI in 6 months, 4 months. And there are documented successes all over in that space. Then once they have confidence in their data, that's where the fun begins.
And so for health system leaders and those in organizations that are looking to maybe figure out what access they have to technology and how if it's affordable, if it fits within their budgets, how would you recommend that they get started on their journey to start evaluating the type of solutions that you're talking about within the organization?
Well, we've seen a major slowdown in the investment of analytics the last couple of years. That's just reality. Why has that happened? Because most organizations that are trying to sell within the healthcare space are still trying to get these organizations to invest millions, if not tens of millions of dollars. They haven't seen that kind of ROI in the last 10 years, so they slow down in the process. If I was sitting in a decision maker's shoes right now, I'd look at the 2 or 3 top issues I'm trying to address as an organization, and I'd go out to RFP or seek proposals to address those issues, knowing that once I solve those challenges, I should be building a platform that addresses many other ones. Make that enterprise approach, but solving the organization. How much influence and power would that individual or leader get if they could come back to the board, come back to their leadership and say, we solve these 2 or 3 problems for you? That's the approach.
So start with narrow pain points, sprint to value, but with a platform approach underpinning it, right? So there's a
long-term strategy.
Long-term strategy. So setting the strategy, proving it on a couple use cases, and then making sure that your underlying partnerships or technology approach scales as you want to expand that.
Yeah, let's make clear here. I am not recommending a black box scenario. A point solution strategy for analytics can get unwieldy in these organizations, and it happens regularly. So there needs to be a long-term strategy, but let's make sure we're solving problems immediately. Let's not invest over years and years to hope we can get there.
So, it's hard to have a conversation in this space without talking about AI and machine learning, right? So as you think about the future and some of these roadmaps, right? Like, what are some of the areas that you're seeing as, maybe a way to kind of get started or, think about preparing data so that, organizations can start to think about leveraging AI and machine learning?
So we are genuinely excited about the future and the impact of AI and machine learning in healthcare. But there's a step 1 before we make the investment into step 10. And that first investment, we have to make sure that the data is clean and the data is accurate. Building machine models on bad data is a bad strategy.
Yep.
And we're seeing many organizations in healthcare approaching it this way. That outcome is not going to turn out well.
What's data's role in healthcare? It's a great question.
We get really focused on the value of data. I don't think we think about the role of data. What's the role of data in healthcare? And it's different than most industries. At least I would argue that. Think about the problems that data solves in finance, or manufacturing or other industries, there's a finite answer in most cases. In healthcare, go to a clinician and give them a data set, even have them build trust with that data set. Are they satisfied with that answer? The answer is absolutely not. A clinician will come back to you with 10 other questions on that same data set. So what happens to most of us that are leading data strategies in organization is we get so focused on a data strategy to answer a question or to address a challenge when the outcome is not what we should be building. We should be looking at what's the foundational value of our data set and how do we get that leveraged so that it can be accessible to everyone and it can be trusted by everyone. Our first step needs to be a really good data integration strategy. And quite frankly, there's a perverse incentive in the industry to keep our data siloed. But the more siloed it is, makes it more impossible for a clinician or administrator to actually see value. They just get confused by the data and then don't trust it and go back to their gut. We got to have a data integration strategy. Once we accomplish that data integration strategy, it's got to be as granular as we can get with the data set. So we can build confidence with our clinicians, we can build confidence with our administrators. And then once that strategy is established, then we start answering questions. That's a value proposition in WellStack.
And when you mention it, when you think about the question about what is data's role, right? I mean, I think that's an interesting way of framing the question because, what we're seeing is when data is trusted and framed, and data is almost effectively a team member in the conversation, right? We're doing some work with large state data collaboratives as well, where the members are coming in and being able to ask questions on these very specific cohorts of patient populations and see it with attributes like social determinants and other things that they cannot get within their EHRs or their current data strategies, right? So we're sort of acting as that team member in the conversation with these regional health systems to help them really understand their populations and then also drive specific outreach and outcomes with those populations. And it's really cool to see sort of it's an organization, but it's effectively data as the team member there where, if you have the right trusted foundation, you have the right tools on top of it to be able to very quickly answer those next 10 questions, right? From a physician who, you present them an analysis on, say, CKD progression or mental health disparities. And it's super exciting. And then when those next 10 questions come, I think oftentimes there's fatigue in the industry because often that can take a month or a year or never to be able to answer those questions, especially if the dimensions that they want to now look at that data on are not available. So being able to kind of be that role and quickly provide those insights, it really starts, we're seeing just a lot of excitement. And then, when you get organizations and clinicians and administrators excited, then, you start to actually see that data making its way to touching the patient, improving the experience, closing care gaps within these critical areas. And that's where we're really excited to see data's role within the team and within the healthcare industry.
And that's why we believe that, along with technology, a services partner with that expertise to have confidence in that data, to leverage the expertise that's in the data.
Absolutely.
When we talk about an integration strategy, we're fundamentally talking about the true perverse incentive of vendors to keep their private IP. And so there isn't a strategy within healthcare to bring diverse data sets together to allow a full patient perspective, a full provider perspective, a full community perspective. The benefit at Redi is over the years and working with the top 100 health systems, at least our team members working with the top 100 health systems, we had to deal with all this acquisition binge that has happened in those, and you had all these different source systems. How do you get reporting? How do you build that out? That's the crux of our business, but it's still fundamentally flawed within a national strategy and within most organizations, because there is an incentive for most high-tech vendors to keep their IP and keep their data sets separate from everyone else, which then doesn't allow most organizations to see what really are the flaws in the gaps in my processes. My finance system says something different than my clinical system. My claims data says something very different than my finance systems say. Well, that's the integration strategy. How do we actually bring all that data together so that whether we're looking at an organization level, an individual patient level, we can see their experience. We can see, is patient satisfaction engaged in their clinical experience? Is their pharmacy data engaged and interacting with the clinical data sources? That's the integration strategy we're talking about. And that's what we're really good at. When you come back to the first problem we see most organizations or challenge at most organizations, which is a financial challenge. What's the industry's solution to most challenges on the financial side? One, it's outsource your entire financial model. Or two, buy this new technology and we'll automate the processes. From a Redi perspective, we see a flaw in both of those strategies. One, these communities have a ton of innate expertise, knowledge of the processes, knowledge of the systems, knowledge of their experience. Outsourcing that doesn't leverage that expertise. So now we have to bring in outside resources who don't understand, the variations in the community, the health inequities in the community. And we see rev cycles actually have bigger challenges in that model. Then when you implement technology, to your point, if the data is inaccurate and the data is not brought together, those automated technologies are not successful. And in most of the rural and underserved communities that we support, they don't have that data integration strategy, they don't have the data trust, and so we see both of those strategies having big holes. That's where we believe an analytics provider coming in and saying, we're not rev cycle experts, we just want to give the clear data perspective, the trustful data to your experts and allow them to fingerprint it.
It's really exciting about the work I think that Redi's doing is when you think about one of the big topics within underserved healthcare, underserved communities, healthcare systems within rural health, rural healthcare organizations is there's a lot of talk about access, right? So it's a lot about access to care. But what I think is really exciting is there's obviously a lot of the downstream problem solving that we're doing with getting the right foundational data model. But also, I think it's kind of cool that you're addressing the access to technology issue, right? So many of these organizations historically, because of the costs and other types of things of enterprise analytics solutions, there's a barrier of access for those smaller, underserved communities to have access to technology and services that can really help them move the needle. So that's one of the things I'm most excited about, with the work that you all are doing, and then obviously including WellStack into that. It's really great to see.
Well, thank you. I mean, from our perspective, the first step is helping them leverage their technology to understand the value of the data that is generating today. Once they can trust and use that data, then how do we help them move to the next steps into the process? And that's the partnership with WellStack that we're grateful for.